Right, we're starting the day with the Trailblazer ceremony. The Trailblazer ceremony is fantastic. It's only been going for about 4 or 5 years, but I think it's a really, really brilliant innovation. And it was actually commenced when Minister, I think, Greg Hunt started the Trailblazer Awards. And the Health Minister's Award, and this is the Federal Health Minister's Award for Nursing Trailblazers, is actually the only award of this kind in Australia. It recognises nurses who, through qualities such as leadership and innovation, are helping transform Australia's health and aged care systems. Trailblazers are recognised for making a difference by improving quality care, by keeping their communities healthy, by ensuring access to treatment and care for everyone, by recognising that some members in the community require a different approach to achieving good health. And if you think about some of the trailblazers that we've had over the years who've done wonderful innovations with recycling, with healthcare for vulnerable populations, I think last year's Trailblazer, or it might have been the year before, had developed a system for people with needle phobia. Some quite amazing and innovative things out there. So I'm really excited to hear about what this year's Trailblazers have been up to. And so what we're going to do now is we're going to see a video of this year's 3 finalists. Here you are, this year's Trailblazer finalists.
I'm Andrea Taylor, the Nurse Manager Researcher for Surgical and Perioperative Services at the Royal Brisbane and Women's Hospital in Brisbane. JEDI came about approximately 10 years ago, and it's a nurse-led model of care designed to improve outcomes for older adults who present to the emergency department. The model was designed because of the increasing numbers of older adults that were presenting to the ED, but not only in number but in age. And up until that point we really didn't have any specific special process for helping and caring for older adults. So something had to be done, essentially. We researched and then designed the model around what would fit with our local emergency department, and in that process I did my PhD, which looked at the screening and assessment nursing component of the JEDI service, and the outcomes were very positive. So if a patient was seen by a JEDI nurse in the emergency department, they had a decreased length of stay, and if they were admitted to the hospital, they also had a decreased length of stay there as well. The Health Minister at the time provided a portion of $20 million recurrent funding to then disseminate it to 25 emergency departments throughout Queensland. So now JEDI is throughout most emergency departments in Queensland, so older adults can experience specialised care and an expedited process through the emergency department. Being recognised as a Trailblazer finalist is extremely humbling and very surprising. My advice to other nurses looking to improve models of care would be brave and courageous, have tenacity. You know, if you have a goal and you know what needs to be done, it takes a big whack of holding on to your dreams and just be very focused on what you need to achieve. Sometimes these are difficult roads to undertake and the journey can be long, but stay true, stay focused, and you'll get there in the end.
Hello, I'm Michelle Barakat-Johnson. I'm a conjoint Professor of Wound Care and Skin Integrity at Sydney Local Health District and the University of Sydney. And my professional background was very much in chronic wounds and complex wounds. My PhD was on pressure injuries and how to reduce pressure injuries at Sydney Local Health District. In 2014 we had the highest incidence of pressure injuries across the state, and I used an implementation science approach, which was a part of my PhD, to reduce the incidence and prevalence, and I worked with a large group of nurses, doctors, allied health and patients to prevent pressure injuries at Sydney Local Health District. We've been able to prevent a lot of pressure injuries for a number of years, where the lowest in New South Wales. So my innovation is the Wound Care Command Centre. That's at RPA Virtual at Sydney Local Health District. It's a nurse-led model of care, and our primary aim is to provide prompt, specialised wound care to people who are in need of wound care and can't get in to see either their specialist or GP, or even provide advice to a nursing clinician on the ward around wound care. The idea came about from a home visit to a patient in 2017. This patient had missed a lot of her appointments that were scheduled with the vascular surgeon, and when myself and the team went into her home to do a home visit, we realised why she wasn't able to attend any of those appointments. She couldn't actually walk, she had multiple ulcers, she also had a chronic illness. Even if she was able to get to a vascular surgeon, she wouldn't be able to afford it. So it really made us think about, well, you know, how is it that we could get wound care, prompt specialised wound care into a person's home? Well, to be recognised as a Trailblazer finalist, it's definitely humbling, and I feel very honoured. This award, though, I need to say, is not just about me, it's about the team. I just actually think that as nurses, we're in the prime position to spot things, to be able to change them, and I believe every opportunity should be that. I believe that innovation doesn't have to be anything big, and it doesn't have to be perfect, it just has to begin.
My name is Caitlin Cook. I'm the founding director of EcoDefend, but by background I'm a registered nurse. EcoDefend started around 4 years ago now. I was working on a paediatric ward in the height of COVID. I was looking after this little premature baby. He had just had a procedure done at another hospital and he was in COVID quarantine. Every time I walked into that baby's room, I had to fully don my PPE, and then the second I left, I had to take that off. And I thought, how much of this stuff have I used? And I worked out in my head, it was around 50 sets. I fell down this kind of rabbit hole of research. I learned everything there was to know about mask standards, and I was just absolutely blown away by the size of the problem. So I had to come up with a solution. After a lot of research and connecting with the manufacturer, we began to send prototypes back and forth, testing different materials. Finally, we come up with a combination that was 100% compostable and what I thought would protect in the same way that the normal plastic mask would.
I think EcoDefend's face mask is different and special, not only because it's fully compostable in 180 days into organic matter, which is great for the environment, but it was also designed by a nurse for nurses. So to reduce things like headaches, brain fog, mask acne, and microplastics in the lungs. If we were to do this in 5 or 10 years, looking back, we could have saved millions of tons of plastic from landfill. The impact we could have on the environment is not a minor one, it would be quite significant. When I first received the email that I had been selected as a finalist for a Nurse Trailblazer, I thought they'd sent it to the wrong person. For me, being nominated as a finalist for this is recognition that people are starting to listen. One nurse at a time, one patient at a time. I believe together we can make a massive difference.
Wow, they're so inspiring, aren't they? Such amazing stuff. Think about those people and think about what Deb talked about yesterday about dream, courage and legacy. And now I'd like to ask you to join me in welcoming to the stage the Honourable Mark Butler, MP, Minister for Health and Ageing, Minister for Disability and the NDIS, to present this year's Trailblazer Awards.
Well, good morning, everyone. Timing is everything. I didn't know Canberra had peak hour. It's brief, but it's intense. So sorry I missed those 3 videos. What an absolute delight to join you. I don't think I've ever been able to join you in person. I've done some videos and hookups to these conferences, but I'm absolutely delighted we've been able to have our diaries come together in the nation's capital. And at the beginning, obviously, I want to acknowledge that we're coming together on the lands of the Ngunnawal and Ngambri people and pay my respects to their elders past, present and emerging. It's a gracious thing to do, to acknowledge country, but it's also so important at a health event to acknowledge the enormous and in some areas growing gap in life outcomes and life expectancy between Indigenous and non-Indigenous Australians, and recommit ourselves to the hard work of closing that gap. I'm really delighted to be here. Catherine was telling me that last night you went to the War Memorial to pay respect and tribute to the extraordinary work that nurses did in the various conflicts, particularly the 2 big world wars, and in particular to Vivian Bullwinkle. And later this morning, Trish Cook, who Jed Carney tells me is the 9th nurse ever to be elected to the Australian Parliament, will be giving her first speech as the new member for the new seat of Bullwinkle over in Western Australia. So I'm really looking forward to going over to see that. When I visited one of the primary care clinics that had become a Medicare urgent care clinic in Perth with Trish in the lead into the election campaign, she had worked there as a primary care nurse. I'd met her the year before at a Melanoma Institute Australia conference where she was presenting on her PhD work about the benefits of patients receiving chemotherapy at home. She's just going to be a terrific addition, following in the large footsteps, of course, of that terrific union leader, Jed Carney. I'm amazed it's only 9. Most states send 9 lawyers every single election to the federal parliament. We saw a psychologist give her first speech yesterday. We've got the first female pharmacist who's one of the assistant ministers for health. There are more doctors in the parliament than ever before. As the health minister, it's a little intimidating having all these very highly qualified, deeply experienced health professionals in the parliament. But once I get over that little insecurity, it is really adding enormous value to our debates as a government and to the parliamentary debates about what is obviously such an important challenge and opportunity for the Australian people. And before I get to these amazing Trailblazer awards, forgive me one more indulgence. If you have the chance, have a look at the government caucus that is in the parliament today. I've been around a while. When I was first part of the debates about whether we should have affirmative action rules in the Labor Party 30 years ago, well less than 20% of the Labor Party caucus were women. It's now 57%. As a middle-aged white male, I'm now in the minority for the first time in human history, I think. It's 57% women, but we also have the most culturally and ethnically diverse party room in the history of the parliament. We have a 21-year-old in our caucus. We have a number of caucus members who are 70 or thereabouts. So bringing all of the generational perspectives to the challenges and opportunities the nation has. We've got someone in the caucus who barely hits 5 foot. We've got someone who's 7 foot. From the seat of Leichhardt in far north Queensland, who used to be the centre of the Cairns Taipans basketball team. It is like the nation, for the first time ever, looking in the mirror, looking at that government party room, and I'm just so proud of the talent and the diversity that we have there now. But it's my pleasure to come and talk to you a bit about our commitment to continuing the work we started in our first term of government to expand and lift the work of the 450,000 or so nurses and midwives in this country. We've done so much together with the college, with the federation, with other peak nursing bodies, already to do things like remove collaborative arrangements as a legal requirement, to lift the Medicare rebate for nurse practitioners by 30%, to expand scholarships I was amazed when I came back to the health portfolio a few years ago, having been a health minister in the Rudd and Gillard government, there were still only 2,000 nurse practitioners in the country. That was the number there was 10 years ago, in spite of all of the opportunities we have to tap into those postgraduate skills. So expanding scholarship opportunities, removing collaborative arrangements, increasing Medicare rebates, giving young nurses particularly a sense that they can build a career if they want as nurse practitioners or endorsed midwives, but lifting also and expanding the scholarship opportunities to make sure that we had enough primary care nursing through practice nurses. But there's a lot more work to do in the second term. The scope of practice review that Professor McCormack delivered to us in the latter part of the last term has enormous opportunity to tap into that extraordinary reservoir of skills and experience and compassion and training that the largest group in our healthcare workforce, that is nursing, has. It's a great opportunity and it will help us meet some of the demand challenges that we have in our healthcare system. So I'm really looking forward to working with the college, working with other peak nursing bodies over the coming few years to continue that work that was such an important part of our first term. Without further ado, it's my great opportunity to, I don't know what I'm doing really. Am I announcing the winners or am I talking about the...
Announcing the winner.
Right, okay. You've heard, you've seen...
And then having your photo taken.
Oh, great. Love that. You've seen the videos of the 3 finalists out of what Catherine said to me was an extraordinary and quite large pool of nominations for these Trailblazer awards. You'll all agree, I'm sure, that all of them, particularly the 3 finalists, are doing just amazing things. I've read about each of the 3 nominations, but there can only be one winner, and the Nursing Trailblazer for 2025 is Professor Michelle Barakat-Johnson. Health and safety laws.
Congratulations, Michelle. Our first runner-up, Dr. Andrea Taylor, unfortunately isn't here today, so we will find a time to give Andrea her certificate and her statuette. And our other runner-up, I'd like to invite to the stage to receive her certificate and statuette and have a photo opportunity with the Minister, is Caitlin Cook. And congratulations to all of our Nursing Trailblazer finalists, winners and recipients over the years. How wonderful it is to see so much innovation in nursing. Could I also take this opportunity to thank the Minister for finding the time to come today. I'm very pleased that our diaries aligned and that you have got to experience a Canberra traffic jam. Just before you go, I've only got 2 things. It would be really remiss of me as the MC and a registered nurse myself not to say these 2 things to you: National Nursing Workforce Strategy and registered nurse prescribing.
Well, I'm pretty sure we endorsed the registered nurse prescribing model at the last Health Ministers meeting in the last fortnight. Set that back
I think
to
it's
the
about
board.
implementation.
Implementation. Okay. You didn't use the implementation word.
Sorry.
You all have to be here for this conversation. Thank you very much. All the best for the rest of your conference.
One more round of applause for the Nursing Trailblazers. And how fabulous to have the Minister able to join us here today and go away with a couple of missions to accomplish in his next term. It would be remiss of me not to have done that, I think you would all agree.